When dealing with blood or other bodily fluids, standard precautions dictate that you should always handle all interactions with bodily fluids as though they were infectious.
You don't have to find out any particular history about from whom they came. You just assume that these are infectious.
So if somebody does cut themselves, we treat it as if they have HIV or hepatitis C. Everybody can have a clean razor once a day. If they shave twice that day, they can have 2 razors. We treat everything as if it's contaminated. So anytime something happens, such as if somebody cuts themselves, we'll make sure that that's covered. Depending on how big a blood spill it is, we can contain the area and keep others away. You know, if we have to throw towels, if it's a big puddle of blood, of course, we can throw a towel down on it, contain that, get our gloves on, get our bleach water, and clean it up.
People might have a bloody nose or injure themselves, maybe cut themselves in the kitchen. So the first thing you want to do is hand that person some paper towels to stave off the blood flow and have them sit down so they don't fall down. Some people get a little woozy when they see blood. Sit down, calm down, and cover that. And then the staff person can go and find their blood cleanup kit, which should include some gloves and some cleaning up materials, lots of paper towels to blot up anything, wet it down with bleach, wipe it up again, and then bleach the whole area again and let that sit for 5 or 10 minutes to evaporate. Just put that in the regular trash. People should know how to do that, and there should be the equipment available for folks to do those things if there were a blood spill of some kind. Having access to real good hand washing is the next thing too. The environments should make sure that those facilities are well stocked with all the necessary equipment to do good hand washing.
We are an HIV prevention program, so the main goal of our program is to stop the spread of HIV, hepatitis C, and other bloodborne pathogens. And so how we do that is we exchange needles. It's an environment where people can feel safe and sort of validated as a human being. A lot of the folks that we deal with don't have very positive interactions throughout their daily life. And so this is a place where there's no judgment. We're not vilifying anybody for the behaviors they're engaging in. We're just trying to make them be as safe as possible.
And a lot of times that level of encouragement will bring a person around to wanting to change altogether. And needle exchange has been very instrumental in helping people get on the methadone program or into other forms of treatment. And also just a place where they can connect with people who care about them.
Well, we highly encourage folks to not reuse anything and not share any of their injection equipment. Somewhat different than other needle exchanges around the country and also locally. We actually have to get a syringe in order to give a syringe. But we also provide all the clean injection equipment that one would need for a clean, sort of healthy injection. We also provide case management, so if people are looking to get into treatment or they need help navigating through the social system. We also have an abscess and wound care clinic. Staff can talk with people just about reducing their risk, sort of harm reduction messages, also give them tips on just how to stay as healthy as they can while they're doing what they're doing. Needle exchange is very successful. The rates of HIV infection here in Seattle and King County are very low, between like 2 to 4%, and has been very, very low within this population. I think that the lifestyle of being homeless sort of makes you more susceptible for a variety of different things. Maybe not having a quick enough access to health care or other services. It can be pretty dangerous living on the streets, and people can get in sort of desperate situations where they don't necessarily think about the consequences of what they're doing. One of the things that I think is important for people to know is that injection drug users aren't just the people that you see on Cops and Law and Order or on the news, but they're people that look just like us. When you think about that, it's not just this population that we're doing an intervention with. It's whoever they may have contact with, so their sexual partners, their families. So we're not just keeping this part of a population healthy, we're keeping trying to keep the larger population healthy.
Studies reveal that over 80% of injection drug users in King County are infected with hepatitis C. This statistic underscores the need to employ standard precautions in regard to sharps and needles. Consider having clients dispose of razors in a large sharps container to discourage sharing and reduce exposure risk. Here are some tips for handling bloodborne pathogens. Make a blood spill cleanup kit and instructions readily accessible. All agencies should have a needle stick or sharps injury policy with instructions to wash affected area with soap and water for 5 minutes. Report the incident and document the details of the injury to your supervisor and seek preventative treatment and testing within 24 hours. In general, handle all client belongings and gloves with care. Provide sharps containers and encourage proper sharps disposal. Staff may also wish to consider immunization for hepatitis B.